All right, for those of you who are joining us now for the first time this morning, welcome. This is the Georgetown Global Forum. Our next panel this morning, Doing Well, Doing Good, New Corporate Paradigms. I'd like to start off by introducing Dr. Howard Federoff. Howard Federoff has been Executive Vice President for Health Sciences at Georgetown University and Executive Dean of the School of Medicine since 2007. In this role, he is responsible for advancing the educational and research missions of Georgetown University Medical Center and working with MedStar Health, its clinical partner. Prior to his arrival at Georgetown, he held several senior leadership positions at the University of Rochester. Please help me welcome Dr. Howard Federoff.
Good morning, and it's wonderful to be here and begin another spectacular panel. This panel, as you well know, is the third in the Georgetown Global Forum, Profit, Policy, and Philanthropy, the Keys to Global Development. Today, doing well, doing good, the new corporate paradigm will be the focus of this panel's discussion. This is already proved and will continue to prove to be a valuable day. It's been tremendous to hear about and learn about the intersection of multiple different sectors with regard to their perspectives, and I think that the first panel on global finance was a tremendous illustration of just that. It's great to see new and innovative practices occurring in multiple sectors and how they impact on what many of us, in fact, I would say all of us are interested in. We're fortunate to have an accomplished group of individuals representing the non-governmental organizations, pharmaceutical companies, and other corporate industries, and the panelists will address corporate social responsibility and how to do well financially while doing well morally and ethically. Let me just briefly tell you about Georgetown University, its medical center, and our Jesuit tradition. We train compassionate and clinically oriented physicians who harbor a great commitment to community and social justice. In our evolution of medical education and practice and our clinical research, we are creating an overarching paradigm that will embrace the future. We call this systems medicine. It promises to provide greater salience to the well-known Jesuit principle, cura personalis, the care of the whole person, and will do so by making the best and most compelling evidence drive the future of everything that we now call healthcare. And speaking of compassionate and clinically oriented physicians, let me just briefly introduce Dr. Mark Dybul. Mark is a distinguished scholar and co-director of Georgetown's O'Neill Institute for National and Global Health Law. Prior to joining Georgetown faculty, Dr. Dybul served as the U.S. Global AIDS Coordinator, leading the implementation of the President's Emergency Plan for AIDS Relief, PEPFAR. In this role, he oversaw all U.S. governmental engagement in the Global Fund to fight AIDS, tuberculosis, malaria, and served as the chair of the group's Finance and Audit Committee. Dr. Dybul also served as vice chair and later chair of the Joint United Nations Program on HIV/AIDS, coordinating and the board and serving as President Bush's appointed member of the Board of Trustees of the Woodrow Wilson International Center for Scholars. Before working in the coordinating office, Dr. Dybul served on the planning task force for PEPFAR and led the President's International Prevention of Mother and Child HIV Initiative at the Department of Health and Human Services. At HHS, he also served as Assistant Director for Medical Affairs at the National Institute of Allergy and Infectious Diseases of the National Institutes of Health. Mark studied philosophy at Georgetown and received his bachelor's in 1985. He went on to receive his medical degree in 1992 from our School of Medicine before completing his residency in internal medicine at the University of Chicago Hospitals in 1995 and a fellowship in infectious disease at the National Institute of Allergy and Infectious Diseases in 1998. In 2008, Dr. Dybel received an honorary Doctor of Science degree from Georgetown in recognition of his untiring dedication to discovering a cure for HIV. In February, Georgetown University announced Ambassador Dybel joined the faculty as senior advisor to the president and distinguished scholar and co-director of the Global Health Law Center at the O'Neill Institute. Mark will teach, conduct research, and write on a full range of global health initiatives at the O'Neill Institute, and in addition to coordinating seminars, conferences, and lectures for the broader university community in the areas of global health, HIV and AIDS, and malaria, it's a pleasure to introduce Dr. Mark Dybel.
Thank you, Howard. Thank you, and good morning, everyone, and welcome to this, what's going to be a very interactive and exciting panel. I feel a little guilty. I don't have as lengthy introductions for our panelists because they have, you have their full bios before you, and I want to leave as much time as we can to discuss the important issues. But I'm going to briefly introduce each of them in alphabetical order. We actually have a C, D, and E, and an F. Then we switched to T's, but we did a pretty good job alphabetically. I'm going to begin with Ray Chambers. Ray needs no introduction to people from the business world. I'm sure, as many of you know, Ray was president of his first company before 30 years old, and then went on to be co-founder of Wes Ray with Bill Simon, which, as many of you know, invented leveraged buyouts. As prolific as his business career was, the last 20 years he's had an indelible mark in philanthropy. He's had a hand in virtually every significant, innovative, domestic and international philanthropic effort, co-founder of Points of Light Institute, America's Promise Alliance, Malaria No More. A year ago, he was appointed UN Secretary General Special Envoy for Malaria. Because of his extraordinary work both here and abroad, President Bush awarded him the Presidential Citizens Award last year. Chuck Dages is Executive Vice President of Emerging Technologies at Warner Brothers Home Entertainment. Chuck has an extensive career in what is known as the business in Los Angeles and somewhat here. He's a technical Emmy Award winner for pioneering innovation, and Chuck has a long career of innovation in technology and entertainment, but in the last couple of years he's been an innovator in using core competencies in this new paradigm of development, particularly with the U.S. President's Emergency Plan for AIDS Relief, and gotten to know his work very well. Richard Edelman is the president and CEO of Edelman's, which is the world's largest international independent PR firm, which is quite an extraordinary thing. He has extensive expertise with economic development programs, and will bring a lot of insight to that. He is PR Week's most powerful PR executive, which sounds very scary, actually. And he was Ad Age's Agency Executive of the Year. Desiree Filippone is Vice President of International Government Affairs at Eli Lilly and Company. Before that, she had a lot of experience in the government, which three of us on this panel share. She worked in Evan Bayh's office in the Senate, and then was at the Office of Management and Budget. For those of you who don't know, it's probably the most powerful office in the U.S. government. They set not only budgets, but policy. She's seen both sides now, the government and the private sector, and will bring great insights. And Karen Tandy, bringing up the end of the alphabet, is Vice President of Public Affairs and Communications at Motorola. She also has a long and distinguished career in public service. She was administrator of the U.S. Drug Enforcement Administration, which also sounds scary, the Associate Deputy Attorney General, Assistant U.S. Attorney General, and received many awards, including the Attorney General's Award for Distinguished Service. So please welcome this extraordinary panel of people.